Lift with your legs, not your back. You've heard this phrase before, right? So why aren't you doing it? Well, I'm going to take a guess and say it's because you haven't practiced it. I'm Jamie Dreyer, and over the past 16 years, I've worked with hundreds of clients, and many of them have had some pretty screwy backs. But the number one thing that they've done that has helped their back is to learn and practice how to use their legs and hips more while they stabilize their lumbar spine. Here's what I say all the time. We've got these fantastic ball and socket joints. It's the hip. It's strong. It's a solid, stable joint. You got a lot of range of motion and phenomenal musculature around it to help you move things. But instead, what do people do? Instead of relying on that hip and knee joint, they go ahead and move from their lower back. They go ahead and pick up their shoe or their box or a pencil. I don't care what it is, but they're doing it constantly, and they're bending from their back, which has got this series of small little, not so strong and stable joints with all these little muscles that are attaching them to them. And they're putting a lot of stress on their back. And what do? They end up feeling stiff, achy, sore. They pull muscles. They've got spasms. They're beating the snot out of their back because they're asking it to do stuff that it just was not designed for. So what are we going to do about it? It's those 3 exercises that I told you a little bit about, right? We're going to practice getting better range out of those hips while you stabilize your trunk. So let's get right into it. Exercise number 1, quadruped. All right, as the name implies, quadruped, we're dropping down onto hands and knees, 4 points of contact. I want you to watch that your back isn't rounded, but I don't want you to be hanging on in there also. Find a nice neutral position. And ideally, your toes are going to be tucked under. Now, if you've got arthritis in your big toe, this might be a little painful, so you're off the hook on this one. But otherwise, everybody else, toes tucked under. Your leg is going to come back. Now, we're going to start off here with static quadruped. I'm going to show you 2 different versions. Static quadruped, I'm going to go back with the left leg, straight ahead with the right, and you're going to hold this. You might be wobbling a little bit, but your job for now is to try and hold this upwards of 20 seconds, nice and stable. Once you've nailed it, go ahead and hit the other side. 20 seconds there. All right? That's static quadruped. Dynamic quadruped is just same thing, but we're adding some motion. Instead of holding it for 20 seconds, you're only going to hold it for about 1. Going to come up, right back down to start. Up, and back down. And you're doing that for repetitions with static quadruped 1. Head on, just kind of looks like so. Exercise number 2, squat. So you've probably squatted before. I'm sure you've sat down. But what I want to do is take your squat and increase the range of motion a little bit and practice stabilizing your spine while you're doing it. All right? So go ahead and see how low you can squat comfortably on your own. All right? See how much control you've got. Now make a point of taking what we learned with the quadruped about stabilizing your trunk and keep it and apply it here during your squat. So when you drop down, what I don't want you to do is to round your back and kind of drop down like this. Keep it firm, get down as low as you can. Now, if you're not getting down quite low enough to be able to, say, pick something off the floor, then what you need to do is grab something, maybe the back of a chair or a doorknob, something that you can hold on to so you can kind of control yourself to go a little bit deeper than you normally do. And then use as much power from your legs as possible, but the hands for assistance to just push back up. That's what we're going to do, because the idea is to increase your range of motion, right? Because if you can only go a little bit, then in order to get something off the floor, to touch your shoe or pick something up, whatever, you're going to have to make up that range of motion from your lower back and bend over to get it. And that's exactly what we're trying to avoid, so we can protect your back here, right? Great. Okay. Next, exercise number 3, hip hinge. The difference between a squat and a hip hinge, it's all about the knees. So in the squat, we've got a lot of flexion from the hips and the knee. But in the deadlift, or the hip hinge, we've got minimal knee and a lot of hip. All right? So what you might want to do, if you haven't done this at all before, is get a wall about a foot behind you, interlace your fingers, pull them firmly into your navel, shoulders back. And now push your butt back and try and touch that wall with your hips. Push them back. You might want to feel a little bit of a stretch in your hamstrings. Then you know you're getting a really good range of motion. Now watch it. When you come down here, make sure you, again, you're not collapsing. Keep a nice firm back. That's your hip hinge. Homework time. All right, so if you're on my website, I want you to go ahead and download the mini program that I've got for you there with these three exercises, and I want you to do them over the next 5 days straight. Now, if you're already doing these exercises, or perhaps an even more advanced version of them, what I want you to do is tune into your lower back and see if when you're finishing your squat or your deadlift, whatever kind you're doing, is your back sore? And if it is, I want you to refocus on stabilizing that spine so there's no movement. And if you still can't get rid of the soreness, then I want you to back down on the weight a bit. I firmly believe that the best thing you can do for yourself for the long-term health of your back is to learn how to use your legs and hips while stabilizing your spine. And the best 3 exercises for that are the quadruped, squat, and the hip hinge. If this information's been helpful for you, then, give me a little feel good. Let me know. Hit the like button. And then if you think it's going to be useful for somebody else that you know, then be a friend and hit the share button. I'm Jamie Dreyer. Thank you very much for tuning in yet again. And I look forward to seeing you in the next video. Take care.